So I'm going to start today with cardiac cycle, right? Cardiac cycle, and we will be also dealing with JVP because it is a part, and also with heart sounds. Now, remember one thing, that wherever necessary, wherever I feel, I will let you know that what is a BAQ. Okay, what is SAQ? That means कौन से question पे you can get BAQ or you can get SAQ, and obviously cardiac cycle is one of the most important LAQ, right? Plus कौन सा MCQ हो सकता है, that also I'm going to tell you, so that you are very much also acquainted with the type of questions that will come to you. ठीक है? So let's get started. And as I told you that आजकल you get clinical base studies you get, okay? That means you get a clinical base questions. So wherever necessary, I will let you know that this is the particular clinical base question which you're going to get. So this is a clinical history which I am taking, which will be helpful not only for the cardiac cycle but also for your cardiac output, which will be our next session. ठीक? Now, there is a history of a 62-year-old woman who is coming with atrial fibrillation, right? You've completed ECG, so you are now knowing that what is atrial fibrillation. There is irregularity in the heart rate and the heart rate is increased. And she presents to the physician with shortness of breath, especially when she lies flat in the supine position. She often has to sleep with several pillows, so she's keeping large amount of pillows behind her back, and she is complaining of frequent urination at night, that is called as nocturia. She is also observing ankle swelling, and she is taking digoxin to control her heart rate. On examination, she is found to be slightly hypotensive. You know that the normal blood pressure is 120/80 and uska blood pressure is 90/65. Heart rate is irregular. It is fasten, which is 120, because she is already having atrial fibrillation. On examination, she is found to have bilateral pulmonary rales. That means on auscultation with the stethoscope, rales which are adventitious breath sounds are found. There is a increase in the venous distension in the jugular veins that we called as increase in JVP, and the heartbeat is irregular. There is no murmur. She's having a significant peripheral edema, and she's diagnosed with congestive cardiac failure. Okay, so she's diagnosed with congestive cardiac failure. This is what is the history given to you. And ऐसे होता है कि you are given one clinical question and you are asked the questions which are related to it, right? So sometimes you may be asked the diagnosis also, और कभी-कभी diagnosis नहीं दिया होगा, आपको क्या दिया होगा कि you have to answer the relative questions like what is the cause of fourth heart sound, what are the factors affecting stroke volume, how does muscarinic receptors affect contractility. So we will be summarizing all these towards the end, right? After we complete the chapter. Also, I've taken one MCQ for you, right? That MCQ, again, I expect that you yourself should be able to answer the MCQ at the end of the session. So what is that MCQ? There is a healthy 23-year-old medical student who is participating in a cardiac echocardiography study. So a normal healthy student who is participating in some echocardiography study. Okay? Now there is isovolumetric contraction of the cardiac phase. Now you have to tell that what event takes place in isovolumetric contraction. This is what is the question, and this is the similar pattern which you are getting in the NEET PG, and also the same pattern will be followed in the examination, your next examination, where you will integrate physiology with medicine. So a clinical history will be given to you and a simple physiology will be asked to you. तो इसमें simple physiology क्या पूछी हुई है कि isovolumetric contraction में what is the finding? Aortic blood pressure is rising, aortic valve is open, AV valve, that is atrioventricular valve, is open, or D, the first heart sound is produced. ठीक है? So we will answer this question at the end of our session. So let's now start with what is cardiac cycle. This comes as a 2 marks BAQ. Define cardiac cycle and its normal duration. So what is cardiac cycle? It is the sequence of electrical and mechanical events. Okay, it is the sequence of electrical and mechanical events occurring in a heart during each or a single beat. So as the heart beats, right, it is passing through electrical and mechanical events. That is what is the cardiac cycle. Now remember that these electrical and the mechanical events, they give rise to various pressure volume changes. Okay? So first there will be an electrical event followed by it mechanical event, and इस electrical और mechanical event के बाद और इनकी वजह से, because of that, you are going to get the pressure volume changes. So changes in the pressures, changes in the volume, and the duration of the cardiac cycle is 0.8 second. Okay, the duration of the cardiac cycle is 0.8 second with heartbeat of 72 beats per minute. Now you can divide the events. Basically, when you divide the events, you divide them as systole and diastole, which are basically the mechanical events. सबसे पहले, there are always the electrical events which are taking place. That means you will get changes in the ECG, and there will be the mechanical events, that is what we called as the systole and diastole, which we will be studying in detail because they are going to take place in the atria and in the ventricles, right? Now, before that, this is a very traditional figure, this is a very old figure which we normally consider, and we divide your cardiac cycle into events. Red is a systole and a blue is diastole. Okay, color के हिसाब से you are dividing this circle into how many pieces? 1, 2, 3, 4, 5, 6, 7 and 8. If you look over inside this inner circle is giving you an idea of the atrial events. Okay, the inner circle is giving you an idea of the atrial events. So these are your atrial events. And the outer circle, the bigger one, is giving you an idea of the ventricular events. So ventricular events. Okay? So first I'll write down the events and then I'll explain the diagram back to you. Now if you consider the events in the cardiac cycle, right? These are the mechanical events. Okay, these are the mechanical events which are going to take place in the atria and in the ventricles. So this is our atrial systole and ventricular systole and atrial diastole and ventricular diastole. Okay, so you are getting events which are atrial events and ventricular events. Systole, diastole in the atria, systole, diastole in the ventricles. If you look into this, you will see that the atrial systole is 0.1 second. The duration of the atrial systole is 0.1 second and the duration of the ventricular systole is 0.3 seconds. Right? Whereas atrial diastole is 0.7 seconds. So atria में जो systole है that is only for 0.1 second और जो diastole है that is for 0.7 seconds. And in the ventricles this is 0.3 second and this is 0.5 second. Here you can see that the diastole is 0.5 second. So one thing which is a very remarkable feature of the cardiac cycle is that the duration of diastole, okay, the duration of diastole is more than the duration of systole. देखा आपने, right? सिर्फ 0.1, 0.7, 0.3, 0.8. Significantly, the diastole is more. Is there any significance? Yes, there is. This becomes an important MCQ also. Now, diastole is the period that when actually the heart is relaxing. Okay, actually the heart is relaxing, and this is the period when the coronary blood flow is increased. Okay, this is the period when the coronary blood flow is increased, especially when we speak of the ventricles, and especially of the left ventricle, which is working more than the right ventricle. This left ventricle is throwing blood to the periphery through the aorta, right? And during systole, what happens is that the blood vessels, they get compressed because of the strong contraction of the ventricles, because of the because of the strong contraction of the ventricles, right? So ventricles diastole is the period when actually the ventricles are getting the blood flow, and therefore ventricle ka jo diastole hota hai, it is very very important. So you can see over here 0.1. Now you can understand this. So 0.1 second is the atrial systole, and baki pura 1, 2, 3, 4, 5, 6, 7 is the atrial diastole. 1, 2, 3. 0.3 second is the ventricular systole, and the whole or the remaining is the ventricular diastole. Atrial systole and atrial diastole में there is no subdivisions, but ventricles में they are divided into different phases. ठीक है? So ventricular systole, see systole का मतलब होता है contraction. ठीक है? जब भी contraction होगा there will be ejection of blood. Contraction will be followed by ejection. So the ventricular systole comprises of isovolumetric contraction, also called as isometric contraction, and as I told you, contraction के बाद there will be ejection. Okay, contraction के बाद there will be ejection. So you can see that there is isovolumetric contraction which will be followed by ejection. The first part of the ejection is a maximum ejection, and then is a reduced ejection. Okay, so a maximum ejection and a reduced ejection. You can also look over to the durations. However, it is not very important to remember the duration of each and every component. Even if you remember gross, it is okay. So the ventricular systole includes isometric contraction and ejection. Now you come to the ventricular diastole. Ventricular diastole proper start होने से पहले there is a period which is called as protodiastole, right? Protodiastole. Followed by protodiastole there is diastole proper, and you will get isovolumetric relaxation. जैसे contraction के बाद क्या था? Ejection, isn't it? Contraction and ejection. So in the diastole there will be relaxation and filling. This filling will be again in 3 phases. The first rapid filling phase, diastasis, and the last rapid filling phase. The last rapid filling phase coincides with the atrial systole. The last rapid filling phase of the ventricles coincides with the atrial systole. So here you can see this. See. The last part, this is the last part of the ventricular filling which is coinciding with the atrial systole, right? So now I always prefer to make flow charts, because whenever we use flow charts, whenever we use flow charts or whenever we are studying in the form of flow charts, the writing and the learning both becomes very easy. And as an examiner and as a faculty in college, I always tell my students कि जब भी आप physiology लिखते हो, ensure that you write in flow charts, because flow chart is very very appealing to the examiner. It reflects that you know well, right? So I'll make this topic very very easy for you, although the beginning will be with the atrial systole, right? But I am going to take you or teach you through another way. Remember, we will always start with the electrical events, which I will explain you through the Weger's diagram. But first, let us complete this in the form of a flow chart. Now, how do I begin? That is my way of teaching. I think this is the easiest way of teaching. We know that there is atrial systole, there is ventricular systole, there is atrial diastole, and there is ventricular diastole. And obviously the events, they are going to start in the right atrium, because the right atrium has the SA node, which is supposed to be the pacemaker of the heart. So as this SA node will fire, there will be spread of depolarization, and there will be a simultaneous depolarization of both the atria and contraction of both the atria. दोनों साथ में होते हैं. Right atrium slightly थोड़ा सा पहले because the right atrium has got the pacemaker. This is the actual way, but I will teach you in a very simplified manner so that we are able to write it properly. Okay, so how do I teach you? Now we know that during ventricular diastole, what is happening is that the blood is going to come from the atria into the ventricles. Okay, so we'll write this first in the form of a flow chart, and I'll also make you write down how we write down in the form of the various events. Suppose you get a short note, but पहले ऐसे पढ़ते so that हमको समझ में आए अच्छे से. So the blood from the atria, it comes into the ventricles. Now you know that as the blood will come from the atria to the ventricles through this AV valve, what will happen? The volume of this ventricles will increase, isn't it? The blood is rushing inside. Obviously what will happen is the volume will increase and the changes will take simultaneously in the atria as well as in the ventricles. दोनों में साथ में ही रहेगा, ठीक है? So what is going to happen is there's going to be increase in the volume of blood in the ventricles. Now obviously that when the volume of the blood, okay, or when the volume in the ventricles will rise, this volume is also going to rise the pressure. So both will increase. The volume will increase, the pressure will increase. The pressure is increasing because of increase in the volume. Now at a stage what happens is that the pressure becomes so high. Okay, the pressure in the ventricles becomes high as the blood rises, and it is going to result in this closure of the AV valves. Closure of the AV valves. So atrioventricular valves, which is bicuspid valve between the left atria, left ventricle, and the tricuspid valve between the right atria and the right ventricle. So there is closure of the AV valves. Now as soon as there is closure of the AV valves, what will happen? If you look into the ventricular chambers, there is closure of the AV valves. The semilunar valves, which are going to make the blood flow out, are closed. They are not yet opened. So you are converting your ventricles, okay? You are converting your ventricles into a closed chamber. Right? You have just converted your ventricles into a closed chamber with the AV valves closed, with the ventricle valve, with the semilunar valves closed, and the pressure is rising and rising, but the volume is constant now. मतलब जितना blood atria से ventricles में आ गया, it is blocked. You cannot bring about change in the volume, and therefore this phase where the volume remains constant and the pressure rises, okay, the volume remains constant and the pressure rises, is called as isometric or isovolumetric or isovolumetric contraction of the ventricles. And this closure of the AV valves and the beginning of this isovolumetric contraction is actually an indication that there is now beginning of the ventricular systole. Okay, there is beginning of the ventricular systole. So what marks the beginning of the ventricular systole? What marks the beginning of the ventricular systole will be the closure of the AV valves, right? And the filled blood in the ventricles and the closed chambers. This is isovolumetric contraction. Right? Now I told you that after contraction there has to be ejection. ऐसे ही पढ़ा ना हमने कि पहले contraction होगा फिर उसके बाद ejection होगा. जब relaxation होगा तब filling होगी. Now the rise in the pressure is rising and rising, but there is no change in the volume. Now there will come a point that when the left ventricular pressure, okay, there will come a point that when the left ventricular pressure will become more than the pressure of the aorta, राइट. नॉर्मली द लेफ्ट वेंट्रिकल का प्रेशर इज ऑलवेज लेस देन द एओर्टा. एओर्टा का प्रेशर ही ज्यादा होता है 120/80. लेफ्ट वेंट्रिकल का प्रेशर ज्यादा नहीं होता है. एज द ब्लड फ्लोज द प्रेशर राइजेस. ठीक है. एंड this pressure will now rise, will become more than the aorta, and the right ventricular pressure will become more than that of the pulmonary artery. Okay, so दोनों के pressures, दोनों ventricles के pressures will become more than the pressures of the respective arteries. That will be the point where the semilunar valves, which are the semilunar valves? They are the aortic and the pulmonary, they will open. Okay, the aortic and the pulmonary, they will open. Got it? So the ventricles were filled with blood, the pressure rises, the pressure becomes more than that of the aorta and the pulmonary artery, and that results in the opening of the semilunar valves, that is the aortic and the pulmonary valves, and the results in the ejection of the blood. So there is going to be the ejection of the blood. That means the pressure, the blood from the left ventricle will move out towards the aorta, and the pressure from the blood from the right ventricle will be moving into the pulmonary artery. Now this ejection, as we had seen, was divided into two phases. The first rapid ejection and then a reduced ejection. ऐसे ही पढ़ा था हमने, first rapid ejection and then a reduced ejection. So what are the features of the first rapid ejection? Initially what happens, there is large amount of volume of blood and pressure, both are there, and therefore the velocity with which the blood is rising or the blood is going to leave the ventricle will be more. So there is a first rapid ejection, rapidly, because of because of a gradient, because of the gradient the blood flows out from the left ventricle into the aorta, because this is filled with blood, the pressure is more, the volume is more, and it is going to eject out rapidly. But uske baad kya hota hai? The volume of the blood is less, because majority of the blood has gone out, and that results in a reduced ejection. Okay, that results in a, uske baad there is going to be a reduced ejection, right? So the rapid ejection and the reduced ejection. Remember, is first rapid filling phase mein the ventricular pressure is high. The ventricular pressure is high. That means this phase mein the ventricular pressure will remain slightly more than that of the aortic pressure, because जब थोड़ा सा aortic pressure से ज्यादा होता है left ventricle का pressure, तभी जाकर valves खुलते हैं. इसके बाद there is going to be reduced ejection. Now as there is reduced ejection, that means the flow is reduced, the pressure is also reduced, there is a tendency of the blood to come back. Okay, there is a tendency of the blood to come back towards the ventricles, towards the ventricles. That means what will happen? That means that the blood from the left from the aorta will try to flow back towards the left ventricle, and the blood from the pulmonary artery will try to flow back towards the right ventricle because of the reduced in the pressure. But as this blood moves or tries to go backwards, immediately there is going to be the closure of the the closure of the semilunar valves. There is going to be the closure of the semilunar valves. That means the aortic and the pulmonary valves will close, and that is going to result in your second heart sound, which you called as S2. This phase, when the blood is going to go back towards the ventricles with the closure of the valves, is actually your protodiastole. This is actually protodiastole. So what is protodiastole? The blood is trying to go back from the aorta or from the pulmonary artery towards the left ventricle and the right ventricle, and it is now meeting the closed semilunar valves, producing your S2, and followed by this there will be now diastole proper. This diastole will include our isovolumetric relaxation. Okay, isovolumetric relaxation, and after relaxation there will be filling. Now this is the second heart sound because of the closure of the semilunar valve. What is the first heart sound? Here is the first heart sound. The closure of the AV valves. This resulted in our S1. समझ गया? So isovolumetric contraction जो होता है, that marks the beginning of the systole. Beginning of the systole means S1 and beginning of the diastole means S2. This is, you also get 2 marks BAQ, give differences between the first and the second heart sound. So when you write down the causes, you get the differences. Okay? Now let's come back. Yes. Now what will happen is filling. Now this filling will be in again 3 phases. The first rapid filling phase, or the first, Now meanwhile the ventricles are relaxing. What is happening to the atria? The atria are also relaxing. We have seen that only 0.1 second of the atria is in systole and the remaining of the atria is in diastole. So these atria, they are receiving the blood, isn't it? They are receiving the blood from the large blood vessels, or the venous return is increasing. And because the ventricles have given their blood out, end of systole, there is end of systole, and this blood volume in the ventricles, at the end of the systole is called as end systolic volume. Okay? This is the end systolic volume. So if you get a 2 marks BAQ, what is end systolic volume? It is the volume of the blood remaining in the ventricles at the end of systole, and its normal volume is around 50 ml. ठीक है, मतलब ventricles के ejection के बाद सिर्फ 50 ml blood is remaining in the ventricles. What will happen to the pressure now? Pressure will fall down. That means when we speak of this end systolic volume, the pressure in the ventricles will be very less. Rather, it is also going to be less than the pressure in the atria, because meanwhile the ventricles have emptied. What the atria are doing? The atria are filling and filling. उनका blood तो बहुत सारा हो गया है ना, so उनका pressure ज़्यादा रहेगा, but ventricles का pressure कम है. So this reduced pressure in the ventricles, get it very clear. Rise of pressure in the ventricle, closure of the AV valves. Reduced pressure in the ventricles will now result in the opening of the AV valves, that is your tricuspid and your bicuspid valve. And as the valves open, the blood is already filled up in the atria. It will rush into the ventricles. So the atria were just waiting for the valves to open, and they were ready to give the blood to the ventricles. So this is the part where I started my cardiac cycle from, isn't it? So this is the part. So opening of the AV valves resulting in the first rapid filling phase. Now as this blood rushes into the ventricles, it sets vibrations in the wall of the ventricles and results in your S3. So what is the cause of the first heart sound? Closure of the AV valve. Second heart sound, closure of the semilunar valve. Systole, diastole. Third heart sound, it is during the first rapid filling phase of the ventricles. As the blood comes from the atria to the ventricles, it rushes into the ventricles and creates a vibration in the wall of the ventricles. So that results in your S3. Now after this, there is a period which is called as diastasis. What is diastasis? Diastasis is a phase where there is a very slow filling of blood, okay, where there is a very slow filling of the blood in the ventricles, or it is the slow filling phase in the ventricles. Because अभी अगर आप imagine करोगे, the majority of the blood has come from the atria to the ventricles, okay, the majority of the blood has come from the atria to the ventricles. So the ventricle का volume is now increased but the atria का volume is now less, है ना. पहले कैसे था, the atria were fill and the ventricles had less blood, but this blood, it came from the atria to the ventricles, so the ventricles have filled, ventricles का पूरा filling हो गया, right, atria volume कम हो गया, so there is a non-turbulent or a very small amount of the blood that is percolating into the ventricles, that is called as diastasis. What will happen immediately after diastasis now? There will be the last rapid filling phase of the ventricles. Last rapid filling phase of the ventricles, which I told you is going to coincide with the atrial systole. It is going to coincide with the atrial systole. The first rapid filling phase, okay, ये वाला जो हमने देखा था, the first rapid filling phase is responsible for 70% filling of the ventricles, and this is a passive filling of the ventricles because the blood is just going down its gradient. The blood is more in the atria, it is coming down its gradient into the ventricles, or it is along the gradient and it is passive filling 70%. But the small amount of the blood volume, that is around 30% of the blood volume from the into the ventricles from the atria, is going to be caused only when the atria contract. This is also called as your atrial systole, which is coinciding with the last filling phase of the ventricles. So this is kind of an against the concentration. It is an active filling of the ventricles. It is an active filling of the ventricles because this filling will not take place unless and until the atria contract. That means if there is a paucity in the atrial contraction, if there is a problem in the atrial contraction, if the atria are not functioning well, that will also contribute to what? Lesser filling of the ventricles, isn't it? Because we need this last atrial kick. This is also called as the atrial kick, and it is responsible for your S4, that is your fourth heart sound. Okay, remember that normally only S1 and S2 are audible. S3 and S4 are not audible. Right, they can be recorded but they are not audible. However, S3 can be audible in athletes, in young children, or with left ventricular hypertrophy like in athletes. But S4 अगर आपको कभी भी सुनाई देता, it is always pathological. So in any of the physiological conditions you will never get S4. ठीक है, it is always pathological. Right? So this is how the atrial this is how the atrial cycle, I mean the entire cardiac cycle is taking place. Now if you want, ki ma'am, how will we write down, suppose if I get a question, on isovolumetric contraction. You may get a short note on isovolumetric contraction. How am I going to write? So you can write over here. We have seen that isovolumetric contraction means what? Ventricle ka contraction. So जब भी we say that the ventricles are going to contract, contraction is a mechanical event, right? Contraction is a mechanical event. This will always be preceded, और इसके पहले हमेशा क्या होगा? एक electrical event. वो electrical event होगा आपका ventricular depolarization. That means यहाँ पर ECG में you will be getting the QRS complex, which is reflecting your ventricular depolarization. So हमको क्या पता चला कि first there is ventricular depolarization, which is shown by the QRS complex in the ECG. The major changes over here are S1, because the AV valves they close and the pressure in the ventricles rises. Of the left ventricle from 0, okay, from 0 to even about 80 mmHg, whereas in the right ventricle from 0 to around 8 mmHg. So there will be a rise of this pressure. The volume will remain constant. Okay, the volume will remain constant. And as the pressure will rise, this phase will, how will this phase come to an end? This phase will come to an end with the opening of the semi-lunar valves. This phase will come to an end with the opening of the semi-lunar valves, right? So this is the way you are supposed to write the answer, when it is asked how to write. This is the way you are supposed to write when it is, when you are supposed to write a short note on a particular event, right? So when we say of the ejection period, suppose there is a short note on the rapid ejection period, how will you write? Rapid ejection period कब होता है? It is after the opening of the AV valves and the left ventricular pressure is more than the aorta and the right ventricular pressure is more than the pulmonary artery. You must remember that the pressures in the ventricles, they continue to rise. Because the pressures are more, that only is resulting in the rapid ejection of the blood, right? Then यहाँ पर there is going to be also an increased blood flow in the pulmonary artery and increased blood flow in the aorta, because the blood is flowing from the ventricles, so there's going to be increase in the blood flow. This phase actually corresponds to your ST segment in ECG. Okay, it corresponds to your ST segment in ECG. Then there is a reduced ejection phase, okay, where the blood is flowing. Remember, the blood is flowing, but there can be a tendency of the blood to flow back, which will be again prevented by the closure of the semilunar valves. Another important question which you can get is on your isovolumetric relaxation. So जैसे हमने isovolumetric contraction पढ़ा, उसके बारे में similarly you can get a question over the isovolumetric relaxation. So ever you get a short note on isovolumetric relaxation, so you can write that this is a phase when there is a fall of pressures in the ventricles, right? And again, the AV valves, the semilunar valves, all the valves are closed, but this time there is a reduced volume of blood and there is a reduced in the pressure. This has to be mentioned now. There is no change in the ventricular volume. Isovolumetric contraction या isovolumetric relaxation, दोनों में there is no change in volume. This is to be mentioned. ठीक है? So this is the way. If it is a long question of the cardiac cycle, draw a flow chart. If there is a short note, then remember how when you write a short note. Now let's look over to the Wiggers diagram.